Hi, my name is Georgiou. I'm a final year PhD student at Glasgow Caledonian University and a member of the university's Green and Blue Space Wellbeing Research Group. My research is focused on the impact of blue space and human health, and the current study is specifically on mental health. This is a poster of our latest study, which has been published in Nature Scientific Reports and can be accessed by scanning the QR code on the top right corner of the poster. So as you can see, we looked at whether living near blue space modifies the effect of socioeconomic deprivation on mental health. But firstly, let me give you a very brief background. So mental health disorders are currently imposing a very high burden in urban populations. But what is very interesting is that there is a strong socioeconomic gradient in mental health, which means that people living in the most deprived areas have a higher risk of developing mental health disorders than people in the least deprived areas. This essentially means that there is a widening mental health gap in the population. In that sense, urban blue space has been found to offer some mental health enhancing capabilities like lowering psychological distress and generally improving mental health. So, similar effects have been found for green spaces, for instance, but blue spaces are thought to be more equally distributed geographically in the population. So this means that if blue spaces are indeed effective, then they could be used as a tool to close this socioeconomic mental health gap. So the aim of our study was firstly to examine whether this is true, and if so, then quantify this effect. So there is a very big canal regeneration project that's been taking place in the north of Glasgow over the last 20 years. You can see a timeline of some key events of the regeneration in figure 1. Just below, there are two maps of the area. Map A on the left-hand side shows the incidence rate of mental health drug prescriptions, with red areas being the ones with the highest incidence rate of mental health drug prescriptions, and white areas being the ones with the lowest. Map B, on the right-hand side, shows the Scottish Index of Multiple Deprivation, with brown areas being the most deprived and blue areas the least deprived. So, taken together, it is evident that in North Glasgow, the canal is surrounded by some of the most deprived areas in the city, and the area is also characterized by a cluster of socioeconomic deprivation and mental health vulnerabilities, which is an example of the legacy of the deindustrialization. So, moving on to the methods section, we used routinely collected primary care NHS data at individual level. These were mental health drug prescriptions of approximately 2 million people over a 10-year period between 2009 and 2018, and we created two Cox proportional hazard models. The first model had time to a mental health drug prescription event as the dependent variable, and sex, age, socioeconomic deprivation, and pre-existing comorbidities as independent variables. The second model had all the same variables, with an additional variable of distance to blue space for each person's residence. Now, in terms of results, although we did not find a direct effect of blue space on mental health, among other effects, we found that living near blue space attenuates the effect of socioeconomic deprivation by 6% for those most deprived and 4% for those in medium deprivation areas. So essentially, this means that the blue space effect of blue space on mental health comes through the reduction of socioeconomic deprivation, and therefore blue spaces could indeed be potentially used as a tool to reduce mental health inequalities in our societies. And last but not least, this study is essentially a call for blue space regeneration efforts to focus on the most deprived areas of our cities. Thank you very much.